Hello, and welcome to the Ascend Health Show. I'm Nick Angelis. I'm one of the owners of the Ascend Health Center, and I'm here with Mark Gerritsen, my co-worker and friend. He's a psychiatric nurse practitioner then, and we've now done, this might be the 29th or 30th show, and never before have I invited anyone who works with me, because it's a terrible, terrible idea, but it's also going to be a lot of fun. So welcome to the show.
Thank you. Glad to be here, Nick.
And we were a runner-up for one of our shows, so I will feature this prominently and refer to it at least 20 or 30 times.
Yes. Well, congratulations, Nick.
Thank you. It was all the guests who brought a smoothie. I just drank the smoothie during the show. It was great. But today, instead of smoothies, although that would be a wonderful topic of conversation, I assume we should talk about psychiatry, since that's what you do at Ascend Health Center. We're a psychiatric mental health facility. But we both used to work at Cleveland Clinic as cardiothoracic ICU nurses. So why are we both here? Because we're used to someone's dying, quick, grab the crash cart. And now we're more in the field of someone's depressed and let's slowly get them better.
Yeah. Well, I ask myself that every day, but why am I here? Well, I ended up here, both of us have a critical care background. I did that for a number of years, and then I ended up in the emergency room and had the opportunity to interact with people that were having psychiatric mental health issues a lot, and got experience dealing with them there, and saw how things were kind of handled in the emergency department, and that there was a real need for help, and that's kind of what inspired me to.
No, that makes sense, because I had the same experience where we would put them in a room, and then every hour or two we'd open a door. Hey, do you want to hurt yourself? You want to hurt anybody else? Okay, thanks. And then that was the care that we'd provide in the ER for mental health.
Yeah.
So, and even especially before COVID, at our clinic, I would tell patients, just come and hang out in our lobby for a while until you feel better, if you're not quite serious enough to go to the hospital, because that was the experience where you'd go there and they'd stare at you and maybe lock you up for a little bit. So it didn't really make you feel that much better about your mental health.
Yeah. And that's kind of the experience that I had. The emergency room is not designed to address people that are having severe psychiatric issues and crises, and and the doctors, are not trained as psychiatrists. They do the best they can, but there's a real need, and that's how I ended up here, and glad to be here.
Well, what about the opposite approach? So if we're saying that the ER is a miserable place to go if you have a mental health issue, and obviously you still have to go there sometimes, what about people who think they can Google themselves to wellness? And I should say as a disclaimer that Mark and I very much care about patients, but when we do talk to each other, we're very plain spoken. So this is a little bit of an inside look of how things actually work. So if a patient says, okay, here's exactly what I need to get better, why do I need to see a nurse practitioner or psychiatrist in the first place? How do you usually respond?
Well, online resources can be very helpful for many things, but the information that's available is often inaccurate. You don't know what the training and background of the people that are providing the advice. Oftentimes it's other, patients on message boards, those sorts of things that are talking about mental health issues that they have. And those folks don't necessarily have all the training and experience that a psychiatrist or a psychiatric mental health nurse practitioner has, as far as understanding the appropriate treatments, the appropriate medications, that sort of thing.
So you're also talking about reviews of different treatments if you look at to see what patients have said.
Yeah, absolutely. I mean, it's, again, online resources, trying to help yourself is great. And it can be helpful. Sometimes it can get somebody pointed in the right direction, but you know, it also it can be confusing for patients. It can create problems. Again, there's lots of resources available online. Sometimes they aren't the most reliable.
Right.
And
so it might not be like the first line you're saying. Like
right.
Maybe come to us, see what kind of medication might work or what the next step is, and
right.
then you can take it upon yourself to even go further. Since we do tell patients that often that, okay, you can come see us a lot more often, or you can start exercising or eating right, or some of these other things that can at least slow down the amount of time you have to visit a professional.
Yeah.
Because a lot of times for reviews, I often tell patients, well, think of your dishwasher. Like, no one reviews their dishwasher unless it destroys their dishes or absolutely doesn't do anything.
Right.
So obviously any sort of review you see on a treatment or medication, that's for like the destroy your dishwasher type of approach, where it was a rare reaction that really affected someone.
Yeah.
And then they're still really fascinating to read, but as far as gospel truth, it might be and I think we've seen that especially with TMS, or transcranial magnetic stimulation.
Yeah.
Where it's a fairly innocent therapy, meaning that the side effects are almost nothing, especially compared to psychiatric drugs. But then when you start reading reports, it can be challenging. I mean, especially because the type of patients who will qualify from an insurance standpoint for that already have tried multiple drugs and had some issues. So we're already talking about a subset of patients who their bodies already kind of react differently than most people.
Yeah, and that's one of the things, I mean, that we have at Ascend that kind of sets us apart. We have some treatment modalities. We've got TMS, which is transcranial magnetic stimulation. We've got Spravato and ketamine. These are treatments that aren't available everywhere. It's a specialized, we really do try to specialize in helping folks that have been struggling with depression, usually for many years,
right.
and they're used to taking the medications. And again, online resources are great. The first thing that anybody does when we prescribe a medication now, most of these folks go and Google the medication to see what potential side effects there are, that sort of thing, and that's okay. We understand that's part of the process, but as I've told you many times, the mind, I tell patients all the time, your mind is more powerful than any drug
Absolutely.
that I can give you. And sometimes, they may go and look up medications and see all these horrible, potential side effects. I mean, everybody's seen the advertisements on TV where, every medication they're talking, they've got somebody smiling and, playing with their dog, and in the background you hear, that it may cause death or blindness or
Absolutely.
a whole multitude of issues. So, it's just important to remember that if we prescribe something, whether it be Dr. Molina or I, that we know the medications pretty well. We've studied them, and if we're concerned about side effects, we're going to tell you about it. Unfortunately, a lot of people take the
Right.
get the medications, and then they have problems.
Yeah.
But sometimes it's the power of the mind. If you think you're going to have problems, it certainly increases the potential for that.
Well, it sounds like you're saying too that it's an individualized approach where
Right.
here's the possible side effects, but for each patient who says they might have a side effect, you have to see, okay, what were your side effects to the last medication you had?
Right.
How many medications have we tried before, and what were the effects? So, because
Right.
I know, both of us have told patients before, well, you've tried and failed 7 other medications. This is a mild side effect. You just need to push through.
Yeah.
And then another case is like, look, we've got 5 other really good ideas. That's fine. Stop taking this one. Come in and we'll come up with something else.
Yeah. Yeah, you're right. I mean, it's, and unfortunately, patients can have side effects from medications, but oftentimes, they're limited.
Right.
They may just take some time to adjust. And one of the things that we really focus on is being conservative in our approach and our treatment and starting people out with low doses
Absolutely.
on medications, because we know that in most cases side effects are dose dependent or dose related. And if you start somebody out at a high dose, you might have problems. And the problem there is that the medication may be a perfectly good medication and may actually help the patient, but if they're started at too high of a dose and their body doesn't have a chance to adjust and they have side effects or problems, they're not going to take it.
And a lot of times when I've told patients that, their response, humorously enough, was, I'm sorry, aren't you the guys that prescribe ketamine infusions where the patient says, oh, I might feel like I'm in outer space? What do you mean you're conservative? But I think that's why we are conservative, because we have these tools that work rapidly and can make great changes in the brain very quickly. So there's not this urge to take the same approach with medications or prescribe a lot of benzodiazepines or stimulants or some of these medications that traditionally in psychiatry, you only look at if all these other classes have failed, because as we mention often, there's a lot of great short-term solutions that will be terrible for people in the long term.
Right. No, you're right.
Not to get you on our usual soapbox about benzodiazepines and stimulants, because obviously for some patients they are appropriate.
Absolutely. Absolutely. But we, again, the treatments have a kind of a more holistic approach. Conservative approach is, I think is the way to go, because it minimizes the chance that patients are going to have problems with medications and treatments, and that increases the chances that they'll actually be compliant and take the medications and get the benefits that we're hoping for.
Right. Well, I think it also depends on the approach of where someone decides to go for their mental health care, because there is the idea of like a more aggressive, let's do this drug, let's not talk to you for a few months, let's see how it does. With us, sometimes it does have to be a bit more fine-tuned, where the patients are calling and reporting back how that worked. Do we need to increase this, decrease this? So sometimes it does require more appointments or more fine-tuning, but usually that's not a complaint of the American healthcare system, that people are paying too much attention to me. It's usually the opposite, that everything's falling through the cracks and I can't get an appointment and that sort of thing.
Right.
So that makes sense. A more conservative approach allows us to gradually fine-tune where we're trying to go, whether it's avoiding mania while preventing depression or depending on the situation.
Yeah, definitely.
Okay.
So
I did have a question where, how do you respond to criticism about psych medications in general or antidepressants? And honestly, some of this criticism comes from me as your coworker, because I'm a nurse anesthetist, so my whole mindset is like, oh, let's fix someone quickly. Like sometimes I've even said like, oh, those psych meds don't work as well as they should, and rather than taking this antidepressant and waiting for a month, why don't you just do Spravato or a ketamine infusion or TMS, where within days we'll get some sort of results. But a lot of times that's not fair, and it's kind of minimizes the work you do and everything that you've learned in your years of study. So what's like a better response to that, rather than when I try to encourage everyone that all the answers are these quick fixes, so to speak?
Yeah. Well, I'm used to being minimized, but
this is actually a therapy session for Mark. That's why we've gathered here today.
But
the trauma of working with me.
Yeah. Well, I'm not a big fan of a lot of psychiatric medications either. I mean, we know that in particular with depression, the standard treatments, the SSRIs, the SNRIs, Wellbutrin, those medications really don't benefit a lot of people that have depression.
Mm-hmm. And they make you more depressed. You feel like, well, what's wrong with me that this standard treatment isn't working?
And they have side effects, you know, whether it be weight gain, other issues. They can have an impact on sleep. You know, there aren't very many medications that you can take that ultimately don't have some side effects. And obviously we'd prefer, you know, in a perfect world, not to have to medicate folks.
Right.
That's why we're so keen on therapy.
Absolutely.
And getting counseling, because we know that a combination of therapy and medication, if needed, we know that that's what produces the best results for.
Right. There's very few side effects
folks.
from talking to someone.
That's true. That is true. Absolutely. So, you know, it's one of those things, you know, or the medications that we use, you know, well, for example, you know, Spravato. It's a powerful medication, and it helps people that haven't benefited from the traditional treatments for depression, like SSRIs and SNRIs. But it, you know, it doesn't work for everybody.
Right.
But it can be very helpful, and a lot of times it can help us get people off of other traditional medications, or at least lower the doses. So, which is a good thing. And of course, TMS doesn't involve medication at all.
Right.
Which
so
is another.
if there's a history of eating disorders or substance abuse or fixations about pills in general, sometimes that's a cleaner way to just treat depression.
It is. It is a cleaner way to do it. You know, it's a good alternative, particularly for people that don't want to take medications. There are some, you know, have been some recent developments medication-wise that we're excited about to help people with depression that work faster, and you know, we're currently evaluating those, but it is tough when somebody comes in and they're profoundly depressed, and you tell them that, you know, we're going to start you on this medication, but you might not feel good for 6 to 8 weeks, if at all. I mean, because again, they don't work for everybody.
Well, and sometimes if meds work right away, it's short-lived, where after a few more weeks, somehow the brain finds another way, almost the ways people will start on a diet and they'll lose some weight, and then the brain's like, actually, my homeostasis is 10 pounds heavier than this. Sorry about it, buddy. So it's not always a bad thing if it takes a little while, because many times it took several different traumatic experiences in life to make someone depressed. You know, there's new data that maybe it's not this serotonin deficiency that you can only treat with Prozac. Maybe sad things happen to you and now you're sad about it, and it's that simple. So that makes sense. And I should say, to be fair, that I have the same view of anesthesia. Just like you're saying, where some of these psychiatric drugs don't help everyone. You know, I'm really like all of the anesthesia drugs, but if someone tells me, oh, I'm going to have anesthesia, usually my first thought is, well, that's a terrible idea. You should avoid these poisons whenever possible. And honestly, that's it's probably a healthy approach for both of us, rather than thinking like, no, these are wonderful things that everybody should partake in.
Yeah, I mean, ideally, if we don't, you know, we can get somebody in therapy and get them moving in the right direction and help them with coping skills, that sort of thing. and avoid medications altogether, that's the best case,
Right.
Scenario. I mean, that's something that we really, it makes us happy. We don't want to prescribe medications or do treatments just for the sake of
Right.
prescribing or doing treatments.
Because that is the thing that often people don't think about this, but you do get locked into the system, because once you prescribe a medicine, then that person needs to come back. They need to talk to you about it, and then you adjust it, and they need to come back again.
Right.
So whenever possible, we do try to tell patients, okay, is there a way that we can do this where you can come in for a checkup because you're like, oh, let's see how I'm doing, but not because you're locked in, which again is our issue with some of the drugs that can be more addictive, or that your body responds to in such a way that it's no longer making those chemicals itself.
Sure.
So, and we've seen that a lot with substance abuse too, where the medication-assisted therapy, you can end up on Suboxone for the rest of your life, or methadone, and obviously there's a time and a place, but it is a pretty chilling business model at times as well.
Well, yeah, and sometimes it involves picking the lesser of evils, and
Right.
Again, I think that the approach that we take is very helpful for patients, and it's the way that I certainly, and you're probably the same way. If you go in to a doctor's office and somebody just starts prescribing a whole bunch of different medications for you and throwing a whole bunch of things at you, sometimes we kind of recoil a bit, just because of our experience in medicine and in nursing. So
yeah, you end up like, what kind of box of Lucky Charms is this? There's funny colored marshmallows everywhere. And I mean, that's a good point too, where both of us feel that because at Ascend we have different therapies not available other places, we don't need to take over everything for patients. They can stay with their psychiatrist. We won't touch any of their medications and just simply do the treatment, because and this is a fault of mine, once you start tinkering with multiple receptor sites and multiple medications, it's hard to tell, well, what worked? What was the secret formula that made you feel better?
Right.
And we can't tell if we're altering too many things at once.
Yeah.
So.
Yeah, it's, what variable produced the positive result, or was it a combination of all? Yeah, that makes it tough. But, I think that it's a good point. When we're treating people with treatment-resistant depression, most of those folks have a psychiatrist that, may well have referred them to us, because we're, again, have kind of a specialty focus. But we can collaborate with their psychiatrist, and it's important to try to maintain a dialogue.
Right.
But it gives us, kind of a sharpened focus, and lets us really, kind of drill down on whether it be ketamine infusions or Spravato or TMS. We can really focus specifically on that, and hopefully adjust things and personalize it.
It helps too, because in that way it's a limited role, and oftentimes it's limited in time too, which no one wants to be dragged into a lifetime of psychiatric care if there's other options. And I should mention too, for anyone watching or listening, that the normal disclaimers about, unless we send you a bill, this isn't medical advice. You need to go to a doctor. As we said about there's plenty of resources online, but they're not personalized for your specific case. So you may hear some things that sound exactly like what you need, but it helps to work with someone to hone in on, okay, what therapy is going to work the best. Because especially if there's been failures in the past, it's important not to go down a road where it's unlikely that it's going to be beneficial.
Right.
And that's something that we are very passionate about. Like, let's most of the patients that we see, they've taken some wrong turns in their journey to getting better. And the last thing we want is to send them down another dead end.
Well, and you're right. And we're not giving, medical advice here.
Yes.
We're just trying
Brilliant advice, but not medical advice.
Right. Well, true. But, the important thing is to have a good psychiatrist, work with them, and follow their advice, be compliant. But we do have some things at Ascend that can help people that aren't, they're a little different. They're outside the box. And we're always happy to talk with psychiatrists who may be interested in trying to help patients that haven't benefited from traditional treatments.
Absolutely.
And
so if anyone has any questions, you can always go to ascendhealthcenter.com, because we haven't had enough time today to really define the difference between like Spravato and TMS and ketamine. But that's what our website's for, because if we start explaining it, then the 22 seconds left in the show will go very quickly. But
yes,
thanks for joining us, and I'm glad that we got to hang out today.
Yeah, that was great. It's always good to talk with one of my buddies from the trenches.
That's right.
at the clinic. So really enjoyed it, and hope to have a chance to make it back here again, and we can talk more specifically about some of the treatments.
Thanks for joining us, everyone.
Thank you.
You are watching WCTV, Wadsworth Community Television.